Okay, welcome everybody. This is Jeff Kay. I'm here with Seymour Samea, and we're doing a podcast today with Rita of NFP and Jake of Amramp. So let's start off with Seymour. Tell us a little bit about the Geriatric Advisory Council, or the GAC.
Sure. Once again, thank you. Good morning, everyone. Thank you for jumping in and being part of our weekly podcast. The Geriatric Advisory Council started many years ago. My lifetime career is senior care management as a geriatric care manager, helping families who are struggling with their parents, with a spouse, sometimes even grandparents. The members are there to help families in the community to give them what we call just a great basic quality of life. And Jeff has been so kind hosting and directing and actually putting this podcast out there to the community. And it's just been terrific. So thank you. It's not about me. Thank you for your membership. Thank you for your friendship and support. Jeff, go ahead. You have an agenda for this morning that'll really be so interesting to people who are struggling with difficulties. Thank you, Jeff.
Oh, sure. Not a problem at all. Um, let's get started with Rita. And Rita, why don't you briefly give us an overview of NFP health coverage?
Okay, so I'm Rita Schoenfeld at NFP Medicare team, and I assist anyone who is Medicare eligible with the complexities of Medicare. So making the wrong decision can be costly, and I'm here to help them all the with all the complexities, Medicare education, how to sign up, when to sign up, how to avoid those lifelong penalties. And I do ask my clients plenty of questions, so you can really get to know their unique situation and feel for what they need, what their needs and wants are. And I'm independent, meaning I'm licensed with several different insurance companies, so them several different carrier options.
Oh, thank you very much. Now, why is 65 the magical number?
So the magical number is when you do turn 65, you are eligible for Medicare. So of course, there may be some other situations that maybe you are under 65, but you have. So anybody who is turning 65 will be eligible for Medicare. Or if anybody is under 65, they also qualify with a qualifying disability, they will be eligible for Medicare. Or if somebody has end-stage renal disease or ALS, which is Lou Gehrig's disease. And those are the people I help. I always tell that when you turn 64, and that's a time when you have to start thinking about Medicare. Because I, of course, assist anybody who already has a Medicare plan, or maybe somebody is 65 or over and they have employer plan and now they're ready to retire. So those are the people I can help.
Oh, that's awesome. And what are the realities of long-term care financial planning?
So Medicare covers short-term medical care. Doctor visits, procedures, surgeries, radiological services, X-rays, MRIs, CAT scans, skilled nursing for limited time, home health care for short time. It does not cover long-term care like custodial care, assistance with daily activities, bathing, dressing, eating, stays in a nursing home for a long period of time, or assisted living facilities. That would be for those long-term care plans, and they cover custodial care, in-home care, nursing home care, or care in assisting living facilities. So it's so important to understand the differences of what Medicare and those long-term care plans cover for proper health care and financial planning.
Oh, that's awesome. Yeah, my wife understands all this, all the Medicare stuff. She'll be turning 66 this year, but I've got a couple years left. Um, so what's the importance of the annual policy reviews?
So I would definitely suggest anybody, particularly who's new to Medicare, that they review their plan within the first month of the start of that plan to make sure that they fully understand what is the plan that they actually sign up for, that there are no surprises, if there are any deductibles, so co-payments, any networks. And of course, I can be contacted throughout the whole year with any questions or concerns. Everybody always know they see the commercials on TV about the Medicare annual enrollment rate, which is the last quarter of the year, December 7th. I'm sorry, October 15th through December 7th. And that's the time to review those Medicare Advantage plans or prescription plans, as those drug plans change every year, the premiums change, the formularies change, and of course, there could be some major network changes along the way for the following year. And that's what we can help with.
Oh,
So,
that's awesome. Seymour, did you have something to say?
no, it's just so important. Rita's been always bringing the point. Do not wait for one day before you're turning 65. It's just a phone call, explain what your needs are, what you've been going through, medical issues. It's just a way to get things done and that no surprises come up. So thank you, Rita. It's so important when people are discussing with you. It's just a one-on-one conversation. Excellent work.
Oh, of course, my pleasure. Thank you.
Now, correct me if I'm wrong. Isn't there a penalty if you don't do it when you're 65?
Well, it really depends on everybody's unique situation. Don't forget, we all have a different situation. So, for example, if somebody is turning 65 and they decide to stop working, so yes, they would have to go on Medicare. If you decide to continue working and stay on large employer coverage meaning 20 or more employees, so you can defer Medicare and stay on the employer coverage. However, if the company that you work for has fewer 20 employees, you have to go on Medicare. That's a Medicare rule. And that's something that a lot of people don't know about. Also, another thing to know is that if somebody is thinking about stopping working, maybe they work part-time now or fully stopping or retiring, and they're contracting with Cobra. Cobra is not going to be your primary payer. Medicare must be your primary payer if you have Cobra and you are over 65. So that's just important to know.
And the
And
penalties that you've discussed that Jeff was bringing up, that could end up lifetime penalties. It's not just, well, I made a mistake and let's move on. It's not that way.
Absolutely. Those lifelong penalties you'll be paying each month for life, and they can be quite costly. I have a handful of clients who unfortunately never signed up for a prescription plan and with a Part D plan, and they are paying $70, $80 each month for life.
Really had a, well, thank you, Rita.
Of course.
thanks. And
Pleasure.
so how do you balance employer coverage with Medicare? How is that done?
Well, as I mentioned earlier, you usually would either go on a Medicare or you would you would stay on the employer coverage. So what we do is that here at NFP we actually can review your options and make comparisons. So I do that very often with my clients. They can send me their current employer plan, and then we'll review both Medicare versus the employer coverage. very often the Medicare plan may end up being less costly. And also with Medicare, Medicare has no networks if you choose to have Medicare and a supplemental plan as a secondary insurance. And you have freedom to go to every single hospital and all those facilities that accept Medicare's payment. So sometimes a Medicare option may be more beneficial for you and also less costly. So, but really knowing that doing the comparison is very important.
Terrific.
Now, excuse me, people often think of insurance as paperwork and numbers, but when it comes to a claim that gets denied or a critical medication, suddenly it's not covered and it becomes deeply personal and stressful. Can you share a story of a time you had to step in as a advocate for a client and solve major medical coverage crises?
That's a great question. In fact, have a great story from last year. Somebody contacted me last year, a friend of a client. He unfortunately was just diagnosed with cancer and he had a Medicare Advantage plan. He was very worried about having to pay 20% out of pocket for chemotherapy. So fortunately, it
Wow.
was actually during an enrollment period. So I was able to guide him and take an enrollment for a separate prescription plan, Part D plan, and a supplemental plan. And because of that change, he now had full coverage and he was able to concentrate on really getting better and not worried about having to pay those high medical costs. And needless to say, he's still keeping his supplemental plan and he's very happy. So thankfully, his situation was really
Yeah.
he's now in the right place.
That, that could have been very bad very quickly. That's for sure. Wow. Thanks for sharing
Absolutely,
that.
because of course, because then with him he has very predictable costs instead of having any of those surprises with the Medicare replacement plans, if any medical services are needed.
Wow.
So, and if somebody wanted to get in touch with you, how do they do that?
It's very easy. They can either call me directly on my direct line, 516-331-4833, or they can email me, rita.schoenfeld@nfp.com. And just wanted to mention, thank you so much for having me. Just wanted to also mention that everybody's situation is unique. So
Yeah.
I encourage everybody to reach out and their needs, whether they're turning 65, continuing to work, or retiring. And do reach out about 3 to 6 months prior to turning 65 or ready to retire. So there's plenty of time for go through Medicare rules, how to sign up, when to sign up, and all those additional options for you.
Excellent. Rita, just repeat those words. It's so strong. Every situation is unique. I mean, that really does say it all. It comes down to just knowing that it's not just cut and dry and you're another number.
Yes,
Excellent.
everybody's situation is unique. That's why I do a lot of asking a lot of questions, really getting
Mm,
to know my client, knowing what are their
mm,
needs, specific. Everybody, we all have specific needs and wants with specific medical conditions. So that's why important we really, really get to know my clients,
mm,
and then for them to know that we are here as independent advisors, licensed with several different insurance carriers in several different states,
excellent.
and we take care of all those plan enrollments and keep continued advocacy and the insurance company.
Uh, Thank you.
Well, thank you
My pleasure.
so
Thank
much.
you.
This is great information.
Mm.
Jake, tell us a little bit about Amramp.
Sure. Firstly, Seymour, thank you very much for having me on your podcast and actually having the Geriatric Advisory Council, which I think is a great resource for anybody that is facing any sort of dilemmas or issues that they're encountering as they're continuing to age. So thank you again for having us. Uh,
Sure.
Am- Amramp is an accessibility company, and what we do is we provide accessibility solutions to those that are looking to either age at home or have an emergency situation where it requires them to be able to have accessibility into their home. And what that would mean is either a ramp or any form of lift. We do stair lifts, vertical platform lifts, elevators, and we also provide grab bars and railings and other items that would allow them to be able to live and access their home safely. And we also do this on a commercial basis.
Oh, that's awesome. Yeah, and it's really important. Now, correct me if I'm wrong. Isn't AmRamp a franchise?
That is correct. So Amramp is a franchise and they have locations throughout the United States and Canada. And we currently own two franchises that cover the majority of the state of New Jersey and parts of New York.
And where did you come from before starting AmRamp?
So I had a pretty lengthy career in finance. I had been in the C-level function and working in as CFO, Chief Operating Officer, and Compliance Officer. And there was a time while I was working in finance that obviously we're spending times optimizing returns on paper. That's what we do in finance. But a family member needed a ramp installed, and we couldn't find a reliable professional solution. And that is when I realized there was a real gap in the market. The numbers made sense, but more importantly, the mission did. And it just made sense for me to move on to actually go into this area where it would actually be meaningful as well as an opportunity, especially in light of what was going on. This was post COVID, and more and more people were looking to age at home as opposed to going into a facility. And looking at the demographics of roughly 10,000 baby boomers turning 65 every single day, and a clear national push toward aging in place, we saw that there was an opportunity not only to follow this mission, which would be meaningful, but it also would there was an opportunity at an inflection point that continued to grow.
Thanks. And how hard was the transition going from finance to a franchise like AmRamp?
It actually wasn't that hard. It really was able to employ a lot of the skills that I had developed over the years, in finance, as well as in operating and compliance and understanding all that and managing others. So it was just a really being able to apply that to a different industry. The only other thing was obviously learning more of construction type of rules and regulations. That was the only real distinguishing characteristic that was different. In terms of the interaction with the clients that we do in finance was somewhat the same, which is one of the key aspects is having patience, having the ability to listen, which is one I think is the most important things that a lot of times people are just trying to sell as opposed to listening to what the needs are of an individual.
Mhm.
And that's true across any industry. It's really having the ability to stop and just listen clearly and intently as to what are the needs of the individual that you are speaking with.
So true. I often tell people there's a difference between hearing and listening.
Yes, very much so.
Mm. Mm. Jeff, I just wanted to ask Jake, you've mentioned several times accessibility. Could you kind of be a little specific about some of the items so when this gets posted, people will know a little bit more? Be really important. Thank you.
Sure. So, when we refer to accessibility, it would really include any items that would allow for ease of access. And some of the items that we actually are installing are all forms of ramps. So we have modular ramps, portable ramps, threshold ramps that would allow for different type of setups that are going to be the most appropriate for the home. Some homes have multiple stairs, which would require more of a modular setup. Some just have a threshold, which would be more of either a portable and or a threshold ramp. And then others also may have multiple levels, and then that would be lifts. So we could provide a stair lift that would actually get installed into the home to allow them to traverse from a lower level to an upper level. Sometimes they're wheelchair bound, and then that would be a vertical platform lift, which in essence is like an elevator that is specifically designed for a wheelchair that would allow the person to stay in the wheelchair and to be able to be moved from one level to another. And then there are some people that want to have an elevator in their home, and it would be an elevator that would allow them to take them to the multiple levels of their home. We also install different types of patient transfer systems. So if somebody is not doesn't have the ability to transfer, so it's a way to transfer them physically from the bed to a chair and vice versa. We have bathing solutions as well, which would allow them, if they're also bound to a chair, it would be able to allow them to access a bathtub and things of that sort. We also do home modifications that if people either needed to be in their home and not in a facility, we could actually modify it so this way they could actually live there safely and comfortably. Or if they wanted to plan in advance, for their ability to age at home, they could actually modify the home so this way they could continue to live there. So things like a curbless shower are always very common request. And if they're wheelchair bound, it would be modifying kitchens and bathrooms for ease of access.
It's just a great quality of life. People just don't know what to do, and you're there.
Yeah, very much so. So a lot of times, especially if it's an emergency where somebody either had to undergo surgery or some sort of life-changing operation, the first thing they don't really know. They don't know what they don't know is really what the situation is. And they could be in a rehab facility and recovering, and they say they're not going to be able to be discharged until their home is accessible. And they reach out to us really just at a loss. It's usually a loved one that is reaching out to us. And it's really just what we do is really, like I said before, it's being able to listen intently and understand exactly what they're going through, and then trying to take away this pain point from them and trying to ease the process. So what we'll do is we'll take the ball from there. We'll listen to them, understand exactly what the situation is, and then we walk them through in detail what we could try to accomplish for them to hopefully make this transition that much easier.
As we all know, it all starts with an event, and from there it could spiral down very quickly. But Jake, you've mentioned several times to me privately, if somebody needed a little wheelchair ramp just for maybe a month or two, that is also a possibility with the firm. There is rental option.
Yes. So the majority of our products are available for rental and or purchase. So a lot of times people may be just recovering, and so they only need it for a short period of time, whether it's a month or two. And sometimes they just don't have the visibility. So we allow them to actually rent it, and they could actually convert their rental to an ownership. So if the visibility is that, you know what, I think that this is something that is worthwhile for us to have in place, for ease of use and for other people that may need it, and or as we continue to get older, they can actually convert their rental to a purchase. So it doesn't force them to make a decision day one. They can actually take their time to make that decision.
So important with everything else going on there. Well, that's great.
Yep.
Jeff, go ahead. What else have you been thinking about?
Well, another question came to mind, and this is probably on a case-by-case basis. But say you're putting this in a house or townhouse or something, but there's an HOA. do people need HOA approval, or is this something that can just be installed?
So, for an exterior ramp with an HOA, they're going to require approval from their HOA, along with any sort of drawings that the HOA could review and determine if they find it acceptable for their overall layout of their community. Generally, we've never gotten a rejection. It's more of a formality just to know that there's somebody reviewing it and making sure that it's conforming to the overall decorum of the community.
Yeah,
Oh, thank you for that clarification.
yeah, that is. Mm.
Now, let's briefly touch on the realities of local relationship building, I'm sure is important for AmRamp as it is in any business.
Yes. So, what we do in order to actually remain local to everybody, and this way also to actually continue to build relationships, is that we're very much involved and actively involved in various community organizations, senior centers, and we go out there and speak with all the various seniors that appear and attend the meetings there to stay front of mind. What we also do is we're doing teach-ins at subacute rehab facilities throughout the state, and we
Mm.
do a quarterly rotation where we're going out to every subacute rehab facility to speak with the discharge planners, the social workers, the physical therapists. So this way, they're aware of the services that we offer, and also just to know that they could rely on us and turn to us when they have questions, which happens quite often, where they just have certain specific situations that they just don't know how to address, and they'll reach out to us as a resource. So we do that, like I said, on a quarterly basis, where we're going out and doing our rotations across all of the subacute rehab facilities, which I think amount to several hundred throughout the state.
Wow. Mm. Yes, it's all about awareness.
Yes, very much so.
And what's your average turnaround time?
So it varies. A lot of times, people will need to get discharged, and they don't have a solution. And it's those situations where we have had times where we've done an evaluation in the morning and we've had a ramp installed in the afternoon. Uh, those are not very common, but we have the ability to actually do so when it is necessary. Generally speaking, we try to get an evaluation completed within 24 to 48 hours, and then just going through the progress of that process, which is to review a proposal and to get us on the schedule. Usually would take from beginning to end about 3 or 4 days in total. It can be expedited, but that's the general turnaround time going from A to Z.
Mm. It's terrific.
Impressive.
So we generally keep the majority of the items that we sell and offer in stock, so that allows us to have that ability to turn things around fairly quickly.
Sure. Mm. And of course, on a individual wheelchair ramp, there is no damage to the home. There's no fear that on that end.
No. So when we install a ramp, the ramps are not affixed to the home or to the property. So they can actually put it in and not worry about, especially if it's a rental property, have to worry about that when it's removed, if at some point it needs to be removed, that there's any sort of impact to the property and the landlord doesn't have any issue with it once it's removed. That is definitely the case with all of the ramps that we put in, whether it's a modular or a portable and or a threshold.
Mm. Yeah, well, that's great peace of mind for everyone. That's for sure.
Very much so.
Nice, nice. Wow, this has been terrific. Jeff, you want to wind down with any of your comments and what's been going on at My Digital Memories? I know you've been out there helping so many people on that end that you can't put a price on memory saving. But go ahead, Jeff.
Oh, thanks. Well, what my digital memories does is we digitize legacy media. What do I mean by that? I mean, people have photo albums, slides,
Mm.
movies, pretty much any type of media. We make it easy to digitize, share with family and friends, and basically preserve it for future generations because
Hmm.
all media has a life expectancy, which most people don't understand. And like, for example, VHS tapes, they pretty much have a life expectancy of about 25, 30 years, depending upon where they're stored, if in the environment. I mean, if they're stored in a hot environment outside in a storage locker, they will last a shorter time than ones that are stored inside. So it's important for people to understand
Hmm.
uh, stuff does deteriorate, which is why I encourage people to get stuff done rather relatively sooner than later.
And
And if you have any questions, please feel free to reach out to me. I'm at 703-861-2793, or my website is www.mydigital-memories.com.
hmm, excellent. And nothing is impossible, but if they are not sure, it would start with a phone call. You'd be able to evaluate before anything gets started. So that's so important. Thank you. Thank you, Jeff.
Oh, thank you.
Thank you for hosting. Thank you for all your hard work of putting this together. And any closing comments that you want to have from today's guest, Jeff? Go right ahead.
Rita, Jake, anything upon closing?
No, I appreciate the opportunity to discuss with you guys and to actually bring it out to the public to bring awareness to Amramp and what the services that we offer. So thank you very much.
Excellent. Thank you,
Our
Jeff.
pleasure.
Yes, and I also would like to echo those words. Thank you so much for having me. Thank you for all the work you do. Seymour and Jeff, very, very important. And Jake, and thank you for the opportunity. And look forward to seeing you soon.
You
Excellent.
bet.
Thank you so much, everyone.
Thank you.
Thanks.
Thank you. Appreciate it.
Thanks. Bye.
Great. Great. Thank you. Really.